Appendicitis, a word most of us have heard, signifies a common medical condition requiring immediate attention. It involves inflammation of the appendix, a small, finger-shaped pouch extending from the colon. While its exact function remains a medical mystery, one thing is certain. When inflamed, it causes significant discomfort and requires swift action. Appendicitis can affect anyone, regardless of age, but it's most prevalent among individuals between the ages of 10 and 30. Recognizing the early warning signs is paramount, as prompt diagnosis and treatment are crucial to prevent potentially serious complications. This essay aims to shed light on the telltale signs of appendicitis, empowering you with the knowledge to seek timely medical help for yourself or your loved ones. Remember, early detection is key to a smoother recovery. The appendix, a small, tube-like structure located in the lower right abdomen, often remains an enigma in its purpose. Despite its enigmatic nature, one thing is clear: when inflamed, it leads to the painful condition known as appendicitis. But what causes this inflammation? Obstruction within the appendix is the primary culprit. This obstruction can arise from various factors such as fecal matter, foreign objects, or even a buildup of mucus. When the appendix becomes blocked, it creates a breeding ground for bacteria, leading to swelling, inflammation, and infection. Understanding the root cause of appendicitis helps us appreciate the importance of early detection and treatment. If left unaddressed, the inflamed appendix can rupture, spilling infectious contents into the abdominal cavity and leading to a potentially life-threatening situation. The development of appendicitis is a gradual process, often starting subtly and progressing over time. Initially, the obstruction within the appendix causes a buildup of mucus, creating pressure and mild discomfort. As the pressure mounts, blood flow to the appendix becomes compromised, further fueling the inflammation. This inflammatory response triggers the release of chemicals that irritate the surrounding tissues and nerves, leading to the characteristic pain associated with appendicitis. As the condition worsens, the appendix continues to swell, becoming increasingly fragile and prone to rupture. The risk of rupture underscores the importance of recognizing the early warning signs and seeking prompt medical attention. Timely intervention can prevent the progression to a potentially life-threatening situation. Early warning signs. Recognizing the subtle cues. Appendicitis often announces itself with a subtle set of symptoms, making early recognition crucial. These early signs can be easily overlooked or mistaken for other minor ailments, which is why understanding them is so important. One of the first signs is often a dull, aching pain that begins around the navel and gradually shifts to the lower right abdomen. This pain is not just a minor discomfort, it can be a significant indicator of something more serious. This pain tends to worsen over time and may become sharp and persistent. It's not just the intensity but the persistence of the pain that should raise concern. Accompanying this pain, other symptoms may surface, such as loss of appetite, nausea, vomiting, low-grade fever, constipation or diarrhea, and abdominal bloating. These symptoms together create a clearer picture of what might be happening inside the body. While these symptoms may not always point definitively to appendicitis, their presence warrants immediate medical evaluation. Early detection and treatment can prevent complications and lead to a quicker recovery. It's essential to remember that the location and intensity of pain can vary slightly from person to person. Each individual's experience can be different, making it even more important to pay attention to your body's signals. However, any sudden, persistent pain in the lower right abdomen, especially when accompanied by other symptoms, should never be ignored. Seeking medical advice promptly can make a significant difference in outcomes. Pain progression, a call to action. As appendicitis progresses, the pain intensifies, becoming more localized and severe. What may have started as a dull ache around the navel transforms into a sharp stabbing pain concentrated in the lower right abdomen. This pain often worsens with movement, coughing, or deep breathing. Along with the escalating pain, other symptoms may also intensify. Nausea and vomiting may become more frequent, and fever may spike. The abdomen may become increasingly tender to the touch, and even light pressure can elicit excruciating pain. If you experience sudden, severe abdominal pain, especially in the lower right quadrant, coupled with other symptoms like fever, nausea, and vomiting, it's crucial to seek immediate medical attention. Delaying treatment increases the risk of the appendix rupturing, which can have serious consequences. Diagnosis and treatment. Swift medical intervention. Diagnosing appendicitis involves a combination of physical examination, medical history review, and diagnostic tests. The process begins with a thorough review of the patient's symptoms and medical history to identify any patterns or risk factors that might suggest appendicitis. During the physical exam, the doctor will assess the location, intensity, and characteristics of your pain. They will ask you to describe the pain in detail, including when it started, how it has progressed, and any factors that alleviate or worsen it. They will also check for tenderness in the lower right abdomen and other signs like fever and elevated heart rate. These symptoms are critical indicators that help the doctor narrow down the diagnosis. To confirm the diagnosis, doctors often order blood tests to check for signs of infection. Elevated white blood cell counts can indicate an infection, which is common in cases of appendicitis. Imaging studies like ultrasound or CT scans are also crucial. These tests help visualize the appendix and assess its condition, providing a clearer picture of the inflammation and its severity. These tests help determine the severity of the inflammation and guide treatment decisions. The results from these imaging studies are discussed in detail with the patient to ensure they understand their condition and the recommended course of action. The primary treatment for appendicitis is surgical removal of the inflamed appendix, a procedure known as an appendectomy. This surgery is essential to prevent the appendix from rupturing, which can lead to serious complications. This surgery is typically performed laparoscopically, using small incisions and specialized instruments, resulting in minimal scarring and faster recovery times. Laparoscopic surgery is less invasive, which means patients can often return to their normal activities more quickly compared to traditional open surgery. Recovery and beyond. Getting back on track. Following an appendectomy, most patients can expect a full recovery within a few weeks. This period is crucial for ensuring that the body heals properly and that the patient can return to their normal activities without complications. The hospital stay is typically short, often just a day or two, depending on the complexity of the surgery and overall health. During this time, medical staff closely monitor the patient to ensure there are no immediate postoperative complications. During this time, pain medication is provided to manage any discomfort. It's important for patients to communicate their pain levels to the medical team to adjust medication as needed. After discharge, it's essential to follow the doctor's instructions for wound care, activity restrictions, and diet. Proper wound care helps prevent infections and promotes faster healing. Gradually increasing physical activity as tolerated is encouraged, but strenuous activities should be avoided initially. Light exercises can help improve circulation and prevent stiffness. A balanced diet and adequate hydration are crucial for optimal healing. Consuming nutritious foods supports the body's recovery process and helps maintain energy levels. While most individuals recover from appendectomies without complications, it's essential to be aware of potential risks like infection, bleeding, and bowel obstruction. Regular follow-up appointments with your doctor can help catch any issues early. Contact your doctor immediately if you experience fever, increasing pain, redness, or swelling around the incision site, or any other concerning symptoms. Early intervention can prevent more serious complications and ensure a smoother recovery.